Hello, I'm Dr. Melvin, and I want to talk to you about the typical process of going through hip replacement with me. If hip replacement is right for you and you decide to move forward, you'll begin by communicating with my assistant to discuss surgical dates and timing. Once you pick a surgery date, you'll be invited to download a patient engagement app called Patient IQ. This is one of the main ways we educate you before surgery and guide you through the recovery process after surgery. We encourage you to use it. Before the operation, you'll also be required to see your primary care physician and possibly specialists like a cardiologist for a pre-op evaluation to make sure you're ready for surgery. This usually happens about 30 days before the operation. In most cases, we're able to arrange for a physical therapist to come out to your house before surgery to do a pre-operative home assessment. We found this to be very helpful in getting you both mentally and physically prepared for the operation. And usually the same physical therapist will come out to see you in your home for a number of visits after the surgery. The surgery can be done as an outpatient or with an overnight stay in the hospital. We'll make that decision together. Regardless of the location, the surgery is typically done with a spinal anesthetic. You'll also receive sedation so that you're sleeping during the surgery, but we don't have to breathe for you. We usually can avoid general anesthesia in most cases, which is preferable. I will also inject numbing medication throughout your hip during the surgery as well to help with pain control. For patients staying overnight in the hospital, you will usually mobilize with physical therapy the next morning and typically be able to leave the hospital around noon. Some patients may need additional nights in the hospital, and that decision will be made based on how you're recovering. Physical therapy will also be set up to come out to your home for about 2 weeks after you leave the hospital. Most patients are initially on a walker for a few days after surgery for balance purposes, and then they transition to a cane for a week or two, again for balance purposes. I don't want you to fall. Most patients will do about 2 weeks of in-home physical therapy, and believe it or not, most hips don't need additional physical therapy. You'll simply continue to increase your walking and do a home exercise program. Hello, I'm Dr. Melvin, and in this short video I'd like to explain to you what we do during a hip replacement. First, I do these surgeries from an anterior approach. In my opinion, there are 3 benefits to the anterior approach. Number 1, I don't cut any muscles, so patients tend to recover faster. Number 2, with my technique, I get to use X-ray during the operation, so this helps with sizing and positioning of the implants. Number 3, because I don't violate any structures in the back of the hip, the risk of dislocation is about as low as we can get it. It's so low I don't give patients restrictions anymore. Once you're in the hip during a hip replacement, we make a cut here and remove the femoral head. We take a metal stem made out of titanium or cobalt chrome, and we typically wedge that very tight inside the bone, and within a month the body grows onto it. In some cases we use a bone cement instead to secure the implant to the bone. On the end of this we snap on a ball, usually made out of ceramic. On the socket side we take reamers and mill out the remaining cartilage. We take a titanium cup at this case that has a coating the bone likes and wedge that really tight on the inside part of the bone. Within about a month, your body grows onto the part. Inside of that, we snap in a liner typically made out of plastic. Occasionally, we use a metal liner in certain cases. When you put it all together, you've got a hip replacement. And this is pretty much what it looks like in real life. Now, this is just a general summary, and I know this is a lot to take in, but don't worry. You'll receive this information many more times throughout the process, and we're always available to answer questions and offer support for your personal situation.